You got a prescription for anxiety, took it as prescribed, and for a while, it actually worked. You felt calmer, more like yourself. Then suddenly, it stopped working. The anxiety came back, even worse than previously. And now you're wondering what happened. Did I build a tolerance? Is my brain broken? Do I just need a higher dose? In this video, I'm going to explain the 3 real reasons anxiety medications stop working and what to do about it. I'll also explain the truth about one specific class of medication that can actually make your anxiety worse over time. I'm Dr. Ayer, quadruple board certified psychiatrist and anxiety expert. One of the most painful things I see in my practice is a patient who finally found a medication that helped, and then suddenly it stopped working. I'll explain why this happens, but let's start with why medications work in the first place. Most anxiety medications, your SSRIs, your SNRIs, work by increasing the availability of certain brain chemicals like serotonin and norepinephrine. These chemicals help regulate mood, stress response, and how your nervous system interprets threats. Think of it like turning up the volume on your brain's calming signal. At first, it works beautifully. The anxiety quiets, life feels manageable again. But here's what most people aren't told. Your brain adapts. These anxiety medications cause what is known as desensitization and downregulation of the brain receptors, the specific regions the calming brain chemicals act on. Over weeks, your brain adjusts to the higher serotonin. Certain serotonin receptors become less sensitive or fewer in number. Some of these changes actually help the medication work, and others may shape side effects or tolerance. And if you think that's challenging with SSRIs, wait until we talk about benzodiazepines, because what happens with that class of medication is a completely different story. I'll come back to that in a few minutes. Let's talk about the 3 main reasons your anxiety medications stop working. Number 1, the medication was never treating the root cause. Here's the hard truth. Anxiety medications don't fix the underlying problem. It only treats the symptoms. Think about it like this. If you had a severe toothache, a painkiller will give you real relief. But if you never treated the infection underneath, the pain always comes back, and sometimes worse. Anxiety works the same way. The medication quiets the alarm, but something in your brain and body is still triggering it. And over time, the alarm could get louder. Those underlying drivers can include chronic inflammation, blood sugar instability, sleep disruption, hormonal shifts, and a nervous system that has been under stress for years or decades. Medication doesn't touch any of those. It just temporarily tones down the noise. And in a few minutes, I'll show you which of these hidden drivers is the most commonly missed in people over 40. Number 2, your biology has changed. The second reason is one I see constantly in my practice, and almost nobody talks about it. Your body is not the same as it was when you started the medication, especially if you've been taking the medication for years. A dose calibrated for your 35-year-old biology may not match what your 48-year-old body needs. This is especially true for midlife adults, but the mechanism affects everyone. Hormonal shifts change how the brain responds to stress. Cortisol patterns shift. For women navigating perimenopause or menopause, estrogen and progesterone, which have a direct calming effect on the nervous system, start to fluctuate and decline. For men, testosterone changes affect mood regulation and stress resilience. These hormonal shifts can push anxiety back to the surface even when medication hasn't changed. I had a patient, a high-performing executive in her late 40s, who had been stable on the same SSRI for 6 years. Then almost overnight, the anxiety came roaring back. She assumed she needed a higher dose. What we actually found was significant hormone dysregulation driven by perimenopause. The medication didn't just stop working, her hormonal environment had shifted underneath. Your gut health also plays a role here. About 90% of your serotonin is actually produced in your gut, not your brain. As gut health shifts over time, it can affect how medications are absorbed and how your brain chemistry responds. Other changes that occur as you get older include blood sugar instability with insulin resistance, as well as mitochondrial dysfunction. Your mitochondria are the powerhouses supplying energy to all your body cells. As you get older, these do not function optimally, affecting your entire biology. The good news is that there are root cause approaches to improve these. Number 3, tolerance and nervous system adaptation. This next reason is the one almost nobody talks about, and it might be the most important. Your brain is a prediction machine. Its entire job is to anticipate what's coming and adapt accordingly. This is an incredible survival feature, but it also means that when you consistently introduce a medication, your brain adjusts its baseline around it. Think about caffeine. The first cup you ever drank probably hit hard. Now maybe you need 2 or 3 just to feel normal. Your brain adapted. Medication tolerance works the same way. With SSRIs and SNRIs, this adaptation is gradual. This is why you may have a positive response from a medication for years, and then over time it stops working. Now let's talk about benzodiazepines. I promised you this earlier and it's important. Benzodiazepines, medications like Xanax, Ativan, Klonopin, and Valium, work differently from SSRIs. They work on a brain chemical called GABA, which is your nervous system's primary brake pedal. Benzos push that pedal down fast. Within 30 minutes, anxiety drops significantly. That's why they feel so effective and why they can be so hard to stop. The problem is that tolerance with benzodiazepines builds much faster than with SSRIs, often within a few weeks of regular use. Your brain rapidly downregulates its own GABA system because the medication is doing the work for it. Here, I want to make an important distinction. Dependence is not the same as addiction. Dependence means your brain has physically adapted to the medication and needs it to feel stable. Addiction involves compulsive use and loss of control despite harm. Many people become dependent on benzodiazepines without any addictive behavior. They were simply prescribed the medication that their nervous system adapted to, and now stopping feels impossible. There's also what I call the withdrawal anxiety trap. When you try to reduce or stop a benzodiazepine, your now suppressed GABA system can't keep up. The result is a surge of anxiety that feels worse than what you started with. Many people mistake this for proof that they still need the medication. Often, it's the medication itself causing the problem. This is why I only recommend benzodiazepines for short-term use in specific situations: acute panic, a medical procedure, a temporary crisis, not for ongoing daily anxiety management. There are safer, more effective long-term tools available. Before we talk about what to do, I want you to pause for a second. Because these 3 reasons are not mutually exclusive, knowing which applies to you goes a long way. If your anxiety returned gradually and your stress load has increased and you're not sleeping well or your diet and lifestyle have shifted, you're likely dealing with reason 1. The root causes were never fully addressed. If your anxiety returned around a physical change, hormonal shifts, weight changes, gut issues, a new health diagnosis, reason 2 is probably in play. Your biology changed. And if you need higher and higher doses to feel baseline, or if you feel anxious between doses of a short-acting medication, that's reason 3. Tolerance has built. Your nervous system has adapted to the drug. In reality, most people I see aren't dealing with just one of these 3 reasons. They're dealing with 2 or all 3 at the same time. Your biology changed, the root causes were never addressed, and your nervous system has adapted to the medication. These things stack on top of each other, which is actually good news in a sense, because it means there are multiple points in the system where you can intervene and start to feel better. So what do you do when your medication stops working? The most common mistake I see: patients ask for a higher dose, or they switch to a new medication and repeat the entire cycle. That approach treats the symptoms, not the system. Instead, here are the right questions to bring to your doctor. How is my sleep quality right now? Have my hormone levels been evaluated? Do I have any signs of metabolic changes such as insulin resistance or inflammation? Has my gut health been assessed? Can I do micronutrient testing? Am I on a benzodiazepine that may be worsening things long term? I often tell my patients, medication is like planting a seed, but if the soil is full of toxins, poor sleep, chronic inflammation, blood sugar swings, hormonal chaos, that seed cannot grow. And I want to mention sleep specifically here because it is one of the most underestimated factors in medication effectiveness. When you're not sleeping well, your nervous system cannot regulate. Cortisol stays elevated, inflammation increases, and no medication can fully compensate for a dysregulated sleep system. I've put together a free sleep guide that walks you through the exact strategies I use with my patients to restore sleep and support nervous system recovery. You can download it in the description below. And if you want to learn more about the root causes of anxiety and how to manage them, then watch this next video.